Behavioral innovations, signs of autism. There are many kinds of developmental disorders found in humans that can cause social, communication, and behavioral challenges. These could be lifelong and present themselves in a wide spectrum of situations, grouped together as Autism Spectrum Disorder, or simply known as ASD. Autism is a lifelong condition that can affect an individual's life and progression, both personally, academically, and professionally. But advancements in scientific research has made it possible for most symptoms to be treated through interventions if the diagnosis is made at an early age. One of the biggest challenges in treatment is that, in many cases, autism is diagnosed much later than the recommended time, which limits the growth and development of children. According to the Center for Disease Control and Prevention, or the CDC, autism spectrum disorder affects 1 in 54 children worldwide. Therefore, early intervention is critical for a child with autism. Although symptoms related to autism vary from one individual to another, some signs are more prevalent among those with the disorder. Autism and other developmental disorders are commonly diagnosed in children aged between 3 to 17 years of age. 40% of children with autism spend little or no time with friends. Attention Deficit Hyperactivity Disorder, ADHD, affects an estimated 30% to 61% of children with autism. More than half of children with autism are diagnosed with chronic sleep problems. Anxiety disorders affect an estimated 11 to 40% of children. Repetitive speech, echolalia, or body movements are common. Children with autism are nearly 8 times more likely to suffer from one or more chronic GI problems. Although each individual possesses different traits of autism, some common characteristics come across globally and are mainly characterized by 2 types. 1. Differences in social communication and social interaction, and 2. Restricted or repetitive behavior, interests, and activities. With regards to social communication and interaction, the prevalent characteristic is social-emotional reciprocity, or the back-and-forth interaction that takes place in communication. Individuals on the autism spectrum find it hard to start or maintain a conversation with other individuals. They are also likely to become introverts and unable to share their feelings with others, while also having difficulty to identify and show their emotions. Nonverbal communication is another area of concern for those with the condition. For example, a child may have difficulty in making eye contact, understanding signs, reading others' body language, and might not know how to behave appropriately when around people. Those on the spectrum find it difficult to develop and maintain a relationship with their peers, friends, or other people. Restricted and repetitive behavior can also present themselves through habits, patterns of speech, or usage of certain objects. The need to follow a certain pattern can be so entrenched that those with autism could become fixated in their interests and get upset over small changes in their routine. In short, they are unable to change or do something new out of their daily routine, which further reinstates and nurtures their repetitive habits. Therefore, early intervention is key to identifying these symptoms before they become permanent. Developmental regression, or loss of skills such as language and social interests, typically occur between the age of 1 and 3, and early intervention services can help children of those ages learn important skills. Getting services as early as possible can make a difference in the development of a child with ASD or other developmental problems. Research shows that early intervention services can greatly improve a child's development and result in better outcomes. While there are many options to treat autism, applied behavioral analysis, ABA therapy, is a leading science-backed and research-driven treatment option for those with autism. The goal of ABA therapy is to harness helpful behaviors and decrease harmful and unwanted behaviors through regular one-to-one interactions. ABA therapy can help in increasing communication skills, improve attention, focus, social skills, memory, and academic achievement, while also aid in decreasing problem behaviors and develop school readiness skills. To see if ABA therapy is right for your child, or to get more information about the signs of autism, speak with one of our experienced client intake specialists. For parents navigating through an autism diagnosis, know that you are not alone. Take the first step and see why families have trusted behavioral innovations for over 20 years.